This video is part of the teaching series from Boston Hernia about the Open Preperitoneal Inguinal Hernia repair surgery recovery. Today I'm going to address the 3rd through 7th day, so the first week after surgery. You've been through the hard part, which is the first 48 hours after surgery. By today, your pain should be starting to improve or improved. Most patients are able to wean themselves completely off of Tylenol and Motrin by the end of the 7 days. Some people do it by the 3rd day, some people do it by the 7th. Your pain is quite tolerable even without pain medication. You may or may not need to ice anymore. Typically by this day, most people are eating and drinking completely normally. In fact, some people feel no pain at all and feel pretty normal, like they can do most things. Some people still are quite uncomfortable and require Tylenol and Motrin around the clock. And because we have such a range on that first week after surgery, it's important to follow your trend. The only trend of alarm is if you're suddenly getting worse, whether it's fevers, whether it's pain suddenly getting worse. But as long as the trend is fairly consistent, either slowly worsening or slowly improving, that's normal for you. If you quickly improve, that's also normal and not unusual, because most of our patients are back to work usually by the 3rd day after surgery. If you've had surgery on Thursday or Friday, you're probably back to work on Monday. If you've had surgery on Monday, you might be back to work on Thursday or Friday. People who work from home are able to work from home typically within 2 to 3 days after surgery. We typically don't recommend you returning to work the day after. But oftentimes self-employed people, professionals, executives are going to be on the computer, are going to be on the phone fairly quickly after surgery, and that's perfectly normal. You should not be making any business decision if you're taking opioids after surgery. But other than that, your activities should be pretty normal around the house. We still don't want you to do housework, yard work. We just want you to do activities of daily living for those first 2 weeks. So long leisurely walks are encouraged, but leisurely and not 10-mile walks, a couple of miles in that first week after surgery. We know it can be challenging, especially if you're an athlete, but that mesh really needs to bind to you internally, and if you overdo it, you can cause the hernia to come back and you won't notice it for a year or 2 after surgery. Rarely will that level of activity can irritate a blood vessel and cause some bleeding after surgery. So, take it easy. You can go to work if you do a desk job. You can't go to work if you do any heavy-duty manual labor or lifting at work. Some of the other thing to expect on that 3rd to 7th day is if you are going to bruise, the bruising definitely shows up by the 7th day after surgery, and that bruising can go down to your scrotum and penis. It can go to the thigh. It can go down to the labia. In women, it can be scary looking. I tell the patients that nothing is going to fall off, but it can look that way. So don't be alarmed if it happens to you, but also don't be concerned if you don't get the bruising. Swelling after surgery or a bulge after surgery is normal and happens to everyone and is always visible between day 3 and 7. That is the natural healing process of the body. Rarely is it ever anything of concern. I have a huge long blog talking about swelling or bulging after surgery that I wrote about 6-7 years ago. In rare cases, does a bulge indicate a recurrent hernia or a superficial hematoma? Really not a lot that would be done about it immediately after surgery unless you're experiencing excruciating pain. and then that's a reason to call and see your surgeon after surgery. We have a rule in our office that if you call more than twice after surgery, we're going to bring you in to examine you. We've learned that most of the time we need to examine you to relieve your anxiety, but some of the time that could mean a problem. In fact, depending on what you tell us over the phone, we might ask you to come into the office because oftentimes we need to lay hands on you. Sometimes it could be as easy as just sending us a photograph of the incision. It's important to cover any private sensitive area when you're taking a picture, especially since you're taking a picture in a growing. And we will provide you an email address for a HIPAA compliant email of a post-operative photograph. But typically, you're going to start seeing some significant improvement, and by the 7th day, you should be feeling good enough that you want to do most things in life.